Good morning, this is Dr. Carlson, Honolulu, Hawaii. I thank you for joining us here in God's Wondrous Paradise. I appreciate your time to review this video. I'll be as brief as I can possibly be brief. This will be the fourth in the series of implant infection removal. In the first three videos I show the preliminary examination, the implant removal, and then the hardware that was taken out of the jaw and the pathological tissue or the infected tissue. That tissue was sent to the Hawaii Pathologist Laboratory here in Honolulu, and the report is as follows. Segments of bone are reactive and partially devitalized. Now, partially devitalized means dead. Devitalized is a euphemism for dead or gangrene. So she had dead and gangrenous bone in her jaw. The soft tissue showed chronic inflammation or an infection due to the implants, fibrosis around the implants, and granulation tissue, which is a tissue reaction of rejection for root canals or implants. She came to me at the end of July. We did her surgery at the beginning of August. In April 2013, she visited her implantologist in Chicago, and he reviewed her situation. She was having these symptoms of pain in her eye, the orbit, the bone, and radiating to the implant area right under her nose, and also down into the right angle of her jaw, and swelling in the submandibular area. The implants had been done about 3 years ago. He said that there was nothing wrong. She had a clean bill of health. He wanted to replace one of the fittings, but she declined the invitation. She came back to Kauai because she had to be here. About June 1st, she came down with a massive systemic infection, bladder infection and general systemic infection of E. coli and other organisms. She ended up in the hospital for about 2 weeks, has been under therapy during June, July for massive infection. And with every antibiotic they could throw at this infection they did, and to no avail. The physician who was attending her in the hospital had been aware of the fact that she had these symptoms in her eye and cheek, and that she was now systemically infected, but didn't ask anything about the mouth. Was there any infection, any root canals recently, any implants, whatever. So I think he missed that piece of the puzzle. And I can understand, because physicians and dentists don't communicate a lot together. The physicians think dentists are kind of like second-rate physicians or surgeons, and they don't interact with us in a respectful, honorific way. Neither do dentists really look at the oral systemic connection. The dental apparatus has a direct impact on the blood vascular system and the lymphatic system of the human being. So when people have chronic inflammations or other issues with other organs, best to bet there's something going on in the oral cavity that should be looked at, either an abscessed tooth or root canal failure or implants that are going south. Going back to this young lady, she appeared in my office with this condition, related to me that she had been under antibiotic coverage. We did the surgery, which is shown in the previous videos. She then left for Kauai. She's been away a month. She returned. Her infection is completely gone. And it's not due to the antibiotics. She's off antibiotic coverage now. About a week or two after she had the surgery, August, she recovered completely. The pain has pretty much diminished to non-existence, but she still has a little bit in the eyeball. But she went to the ophthalmologist and she's got a clean bill of health. So it's some kind of a cleansing process. Remember, pain is nothing more than the movement of toxins or poisons in the body. It's actually a good sign. It's not fun to go through, but it's an indication of cleansing. So in her jaw, she was pushing these foreign objects out. Remember, root canals are gangrenous tissue. Implants are foreign objects that act like gangrenous tissue. The body will have a tendency to push them out under the principle of purification, or what we know as cleansing. She now is recovered. This is September 5th, a day after I saw her. Her healing is remarkable. She has other implants, 4 other implants that show varying degrees of bone loss, periimplantitis, and probably best be removed in time. But we want to do that step by step. So the purpose of this video is to inform the public of the ill-advisability of doing implants. She was told that the reason she should have the implants done is her upper jaw, after the teeth had been removed, was not strong enough or didn't have enough coverage, wasn't a good enough quality for a denture. This was misguided information. Her jawbone is solid. She did not need the implant. She could have had a nice straight up denture done. If you have a good prosthodontist or a good GP like myself to do that, it can be done very competently without implants. I have taken out implants for the last 20 years, 15, 20 years. And every one that I've taken out, and there have been over 15 to 20 of them, I've sent to the pathology lab and they come back with this report and even more threatening conditions like bacteria in the jawbone. There was surely bacteria here, but the pathologist wasn't testing for that. I advise people to stay away from implants. It's not done that frequently. Less than 8% of the dentists in the United States do implants. There has been a decline of implant use since 2009. They say it's due to the economy. I don't think so. I think it's because people are alerted to the fact that it's a very painful procedure, it's time-consuming, it's expensive, and once you're locked into the system of implants, you will have to nurture those, you'll have to be locked in, sometimes you have to go back in and do bone surgery to clean out infected matter, or to refurbish the bone with autogenous bone transplants, or sometimes cadaver bone, bovine bone, or cow bone, chicken bone, synthetic bone implants, and stuff like that. So if that's what you want, go ahead down that tunnel. I've had many people ask me, what should I do, doc? And I say, don't go that way. Move in the direction of replacing a missing tooth or multiple missing tooth. And there is a limitation to the technology we've developed at Carlson Bridge Technologies Incorporated. There is a limitation to our technology. We can't do more than 4 teeth, but we're working on even superior composites to what we currently have, the Carlson Bridge composites that are available. If you Google Carlson Bridge or YouTube Carlson Bridge, you'll see that we provide for your dentist a kit called the Carlson Bridge Wing Ponting. This can be done for a single tooth replacement, 2 tooth replacement, 3 tooth replacement, or even up to 4 teeth. Now that's stretching it, that's pretty risky, but they do work. They're a lot better than removable plates. They're a heck of a lot better than implants. I've had so many people working with me over the last 24 years that have made this a success. And so I'd like to thank those who have gotten behind the Carlson Bridge technology, who present this video to you for your awakening to the foolhardiness of going that direction. If you want to, my advice is go to the best oral surgeon or periodontal surgeon to do the implants, and then find an excellent prosthodontist who can replace the implants or place crowns on them. But if you do your research, you'll find out that you're not going to go in that direction. You'll go in the direction of the Carlson Bridge. I thank you for your time and attention, and you have a great day. Aloha from the beautiful center of the Pacific Ocean in Honolulu. Aloha.